there. Hey, Cynthia.
Hi,
How are you?
I'm good. This is so weird to be on the other
Yes,
side of the.
yes. On the other side of the, even though we're both facing the screen, but this time I'm interviewing you.
I
Uh,
know it's kind of
right.
weird.
So,
I'll try not.
yeah. Okay.
I'll try not to ask you questions about the topic.
Okay. Okay. I hope that doesn't happen. No, definitely no. We expect you to focus on your topic, and well, people are sending you their hearts there. They like you. They like you already. Well, many of you know you already, so many of them know you already. Huh? Some
Yeah, I
people
hope
have,
so. I hope so,
yeah,
especially because
because
they've
they
been
have
with
joined you
us.
at the, yes, they have been with us in Spanish, and they many of them may have been some of your students at the Send course
Yeah,
that you've taught several times already. So I think it's really a lot in context, what we're going to be discussing today. Okay, so how was this day? It was a quiet day,
it was
wasn't it?
yeah, it was a really quiet day. I felt like a Netflix day, kind of.
Okay.
You just want to be in bed watching, movies and drinking something, like
Uh,
cocoa or something like that.
right, right. Yeah,
But yeah, but it was
I was.
a very calm one. So yeah,
Yeah,
I am grateful to be, safe and sound and healthy,
right.
and in spite of everything that's happening outside.
Exactly, exactly. Yeah, yeah. We have to be thankful for that, right?
Yeah.
We have to be thankful. Right. Listen, I'd like to start by reading something, a quote I chose from an article written by Claire Scovel. She wrote this article titled "Growing Up on the Spectrum," and this is what she wrote: "Don't think that there's a different, better child hiding behind the autism. This is your child. Love the child in front of you, encourage his strengths, celebrate his quirks, and improve his weaknesses the way you would with any child."
Love it.
So this way I wanted to introduce the topic for today, autism spectrum disorder in terms of online learning. So any general thoughts you would like to share to begin with?
Well,
Or
we'll be talking about that in a minute, especially about something that it's quite new in the field, and it's related to neurodiversity. But I don't want to talk too soon. I would like to introduce the topic before we talk about that, if that's okay.
okay. Yes, sure. Go ahead. Go ahead. Yes. So should I just go into the questions we have for today?
If
I
you
have
want to,
I have several questions on my side,
yeah.
and I want to remind people. I want to remind people that are viewers today that they can introduce. They can just type out their questions down here. Okay. Someone told me the other day that they weren't able to see this little box with a question mark. Can you see it, Cynthia?
I
Yes,
can't.
you can.
No, I can't.
You can't
But you
either.
should,
For
I guess.
yeah, for some reason, I've tried several times. I tried to like activate it. There's no way I can do that. So maybe you guys, what you should do is basically type out your questions in the chat, and we'll read out from there. So I'd like to start by asking you the general question: what is autism? What is the autism spectrum disorder?
Well, before we do that, we need to know that we need to remind our viewers that a couple of years ago, the Bible we used to diagnose syndromes or psychopathologies um, updated. So we used to use the DSM-4 revised version, and now we are using the DSM-5. And that
Hmm.
means that with this new this update, some things change. And when we use the DSM-4 or the DSM-4R, we used to talk about Asperger's disorder or syndrome, and autism or Rett syndrome, and so many other definition or concepts. And now this new version of the DSM is telling us that they put all of those disorders together, left some out, and they put some together, especially autism and Asperger's. And now we're talking about ASD, or autism spectrum disorder. And according to that manual that we use to diagnose, there are two big groups of symptoms that we usually see when we deal with an individual with ASD. And the first group is related to persistent deficits related to social communication and social interaction. And that means that you'll see, depending on the case, but usually you see deficits in their social and emotional reciprocity. You see deficits in their nonverbal communication, and you see deficits in developing or understanding relationships. And the other big group of symptoms is related to restrictive and repetitive patterns of behavior. And that's why you see that with an ASD individual that they usually have some repetitive motor movements, maybe like this, or maybe like this. Okay, it depends on the person. Okay, but
I'm sorry, and that does depend on the age as well, or it may happen.
It depends on the case. It depends on the case.
Not the age, but the case.
Yes,
okay.
Yes, most of them usually show some stereotyped behavior, and also they are very inflexible with their routines. They're very
inflexible.
Yes, they're very rigid with their routine. And that's why sometimes when we change routines, they start to show disruptive behaviors, because they're very rigid in that aspect. They're very structured in a way. And they also show some fixated interests. Some of them really like machines, and they enjoy take them apart, and they enjoy seeing how things are built. Or some of them are really specialized in languages or math, or it depends on the case.
Right. Let me say something here.
Yeah.
One of the things we encounter as we visit schools in Chile or in Argentina, a lot of language schools seem to have cases of children within the autism spectrum disorder. And now you're explaining why this happens.
Yeah.
So,
and I'm
many.
Yeah. Go ahead.
Probably many language teachers that are now here connected, they're probably thinking, yeah, I know I have a student who falls within this spectrum. And now you're saying why.
Yes. So, and mentioning what do we see in these kind of individuals? What do we usually see? And how we can, in a way, identify them, not diagnose them, okay, but identify them.
Okay, a teacher should not be diagnosing, but
no,
basically
a teacher is a really important part of the process, because the teacher is the one who's spending most of the time with the students, but they don't have the skills and the information, even if they heard us talking about it, to really diagnose. So that's why it is very important for them to understand that teachers are very important, because you are going to give me information I need in order for me as a psychologist to really study the case, but I am the one diagnosing. And this is very important, because it is not easy to diagnose, because
Right.
autism spectrum disorder, as we will talk later, is a spectrum. And I can see so many different behaviors in the same spectrum. And that is
Mhm.
why it takes time and it takes a lot of knowledge to really diagnose and treat this kind of person and their families.
Okay.
So last but not least, I would like to say that another criteria that we usually see in this kind of patients or individuals is that they show some problems with their sensory integration. They have
Mm.
they either have hyper or hypo reactivity to sensory input. Okay. uh,
Okay.
and that it's something you see pretty often with this kind of stuff.
Okay.
Yeah.
Okay. Interesting. You were mentioning, you were saying that teachers are not into the diagnosis work, but they are the ones that might be turning on lights
Yes.
to
Yes.
say something's going on here. Especially speaking of early childhood teachers, right?
Yes. Especially with them.
Uh,
Especially with them, because and we need to say this, the earlier we take the case and treat it, the better the case will turn. Or
okay.
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 So
The
that is
evolution of the
why
case.
it's so important for the team that works with them, um, to get help from the teachers, because they're the ones seeing things and you know maybe identifying some disruptive behaviors or some changes, and that's why um, it is so important for us. So they are
Mhm.
part of the process.
Okay, okay, fine. I'd like to remind people who are watching, I'd like to remind you guys that you have a little paper airplane icon down here, and you can definitely click on it and send our conversation, live conversation we're having with Cynthia Hurtado-Müller about the autism spectrum disorder. If you find it interesting and relevant to other colleagues, why don't you just share it with other friends? Huh? You can do it right now, and also start thinking of the questions you would like to ask Cynthia. Cynthia, I have another question.
Yes.
I've heard the term neurodiversity.
Yes.
How is neurodiversity, if it is connected or related to ASD, and in what way?
Yes, it's related, and I love everything about neurodiversity, because I love the brain, and it's very interesting because there is a scientist that is called Thomas Armstrong, and he started studying ASD brains, and he started to see that. There was, even though they shared some criteria, some diagnostic criteria related to ASD, there were different cases, and he developed this concept that at the beginning was a concept, that said that neurodiversity is the biological phenomenon that establishes that atypical neurological development is a normal human difference that, of course, must be tolerated and respected like any human difference. So what Armstrong is saying is that um, difference, it's normal in humankind. And
Mm,
and this concept started to raise a lot of attention in the scientific community, because it raised a lot of questions, and one of those were one of those questions was, what's normal then? I mean,
mm,
if difference it's what's normal in brains in humankind, what's the reference for a
right.
normal brain? Okay.
Right. So in
And
other words, everybody is neurodiverse.
everyone is
Is that what
neurodiverse.
you're saying?
Exactly.
Okay.
Everyone is neurodiverse. And and then in 2018, which is, as far as I know, the latest and biggest article that was launched related to neurodiversity, said that when they study identical twins that share the same DNA, the same genes, they found that their brains were different. And even though
Okay.
they shared the same DNA, and the scientists were like, I mean, I don't understand what you're saying. How is that possible? And well, maybe you are thinking the same thing. And I would like us to make a little exercise. We can see that we both have eyes, we both
Mm-hmm.
have ears and a mouth and a nose and a neck and hands, but we don't have the same face. We're different.
Mm.
So
All right.
scientists are now saying that even if you have an identical twin, the essence of the brain, the neural network, all the neurons that connect and specialize in different fields, connect because of experience.
Right.
And if you think about that, then you realize that everyone has a different experience, even if they share the same DNA, even if they share the same parents, the same diet, the same bed.
Right.
So this is beautiful, okay, but it's a challenge. It's a
Right.
challenge
Right.
because,
Exactly.
yeah, because now we say, okay, now I understand why they are talking about this spectrum, because inside the line or the spectrum, there can be so many types and so many different ways of ASD to show.
Mm-hmm. Mm-hmm.
So we need to take that into consideration, because sometimes teachers or psychologists or you know, people who work in education, or even parents, we sometimes get frustrated because we say, okay, I used this strategy with Pedrito and it worked, and it really worked, and I tried to
Mm-hmm.
take the same strategy and I tried to use it with Margarita and it doesn't work. And I get anxious and I get frustrated because I say, damn it, like, what happened? I mean, I did
Mm.
my best and it didn't work.
The, the formula isn't working.
Exactly. The formula isn't working. And the thing is that, and we need to understand this, and neurodiversity is not only related to ASD, it's related to brains, it's related to human beings.
Okay.
So we need to try to understand from now on that there are no formulas, that
Okay.
even with the same kid, you know, something might work today, but then 2 weeks later it might not work, because
Okay.
we are usually changing, especially kids that are, you know, developing their brains. So as I said, it's a beautiful thing, and you say, wow, amazing, there is no human being identical to the other. But on the other hand, it's a challenge. It's a challenge, and that is why we that work in education and parents need to be really creative, and to
Mm-hmm.
be really tolerant with ourselves as well, and really understand that there is a spectrum,
Mm-hmm.
and there is difference everywhere we go, because we are talking and relating with brains.
Right. Great. So in other words, it's multifactorial.
Yes,
The way a condition is taken by a specific child,
yes,
right?
yes, yes.
Okay.
And even if they
And
share some symptoms, okay, because you need to show something symptoms in order for a specialist to diagnose the problem or the syndrome. Um, there are even some levels of severity
Okay.
specifically inside ASD. There's
Okay.
level
Okay.
1, level 2, level 3, and level 4.
Four different levels?
Yes, 4
Okay.
different levels.
Okay.
Um,
Okay.
level 4 is the highest in severity. Okay.
Okay.
And we need to understand that in order for us to give that person the
Okay.
best help we can.
All right. And now I have this big question, and maybe some of our viewers now are wondering, can I talk about Asperger, or we don't talk about Asperger anymore?
No, if you hear, and this is a very important thing for you
Okay.
to remember, if you hear a professional talking about autism or talking about Asperger's, be careful because
Okay. Okay.
they are not they haven't
That
updated
updated.
their knowledge. Yeah. And
Okay. Okay.
they might refer to ASD as autism, but that is not correct. The correct
Okay.
term is autism spectrum disorder.
Okay. It's gonna take us a while, to change
Of course.
the tags now, the
Yeah.
words.
Yeah.
It takes us a time. So
you hear
we
that
teach our students.
everywhere. Like,
Yeah, yeah. You
he's
hear
so
that a lot.
Asperger's. No, he's not Asperger's.
Yes. It's not Asperger. Okay,
No.
we don't talk about Asperger. But if we were to talk about Asperger, in the new terms, we would say a high functioning, no?
No.
High functioning ASD? No.
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 That would be ASD.
Okay.
ASD. And when you diagnose, then you'll describe how the language is, how is the I don't know, critical thinking is, or motor skills, and then you describe how the person is, but
Okay.
or what is showing. But
Okay.
no, it's still ASD.
Right. Cynthia, you said a few minutes ago, you talked about how challenging having a child with this condition, no matter what the level of functionality he's in or she's in, it's always a challenge for a parent, for a teacher. And I'm sure that you encountered a lot of questions, a lot of worries in teachers that you met in the SEND courses you taught for us. A couple of years ago, you were in Iquique. I think you were in Concepcion, in Santiago. You did this course, Strategies for Special Educational Needs course, which I think we might re-edit for 2020. So what are some of the challenges I, as a teacher, might encounter with my ASD students?
Well, you usually find 6 big groups of difficulties. Number 1, the fear of change. And that is related to this, the struggle they have with executive functioning deficits. That is why they have issues with when you change their routines, because they have issues with their ability of organizing and planning, and that's related to executive functions. Okay. On another hand, another thing that you can encounter as a teacher dealing with ASD students is issues with focus or attention. And usually we find that students with ASD have what we call a comorbidity with ADD or ADHD, meaning that the ASD comes with this other disorder. Okay.
Okay.
And they might, you have tons of comorbidities with ASD. You have sleep pattern disorders, you have epilepsy, you have other types of disorders. But usually what we have seen is that ASD students have a comorbidity with ADD, meaning that they show issues with their ability to focus or pay attention.
Mm-hmm.
On the other hand, you might find that language, especially in smaller children, is more difficult for them to process. And we have to remember and recognize that during early grammar school years, instruction is often visual.
Right.
And then when this student gets older, this kind of disappears and lectures are more common. So that is why we see that they might have some issues with language. Okay. And I want to give you an example.
Okay.
When I used to work in Norway in a school, I had about 5 or 6 students with ASD. And I remember one of them, she was 16. And I remember one day she came to my office and she was crying and crying and crying, and she couldn't stop crying. And I was asking her, what's going on? Please tell me. How can I help you? And she was just crying and crying and crying. And when she could, just stop crying and she took a breath and she told me, I cannot explain what's happening because I have it all in my brain in hieroglyphs. Do you know what hieroglyphs are?
No.
In Spanish,
No.
jeroglíficos.
Okay. I said like, okay.
Yeah.
All right.
And she was telling me, I think in hieroglyphs, and
Okay.
I cannot express the way I feel, but I can draw you the hieroglyphs so you can try to understand how I feel. And then
Wow.
she started to draw some things. And of course, I didn't understand anything she was drawing.
It was hieroglyphs, yeah.
Yes. But we can see this relationship between visual instruction
Mm-hmm.
and the ability to develop this language and to communicate.
Okay.
On the other hand, well, you see that many of them might show some issues with their motor skills. That's very common. And ASD children especially has challenges with motor skills, and you see, for example, issues related to holding the pen when they're writing, or they usually have problems with participating in physical education activities because some of them might show some reduced motor abilities. Another thing that we mentioned before is about social skills. And children with ASD tend to prefer doing activities by themselves. Okay. Mm-hmm. Which of course makes them more isolated and reduce the opportunities to relate to other kids. And that's something we need to take into consideration. And last but not least, and we mentioned that at the beginning, was about sensory perception. And we need, especially if you are in kindergarten, you need to really remember this, because children with ASD usually struggle with an overwhelming amount of sensory input. And when you are in kindergarten, you usually have, textures and sounds and lights and flavors and sounds and different volumes. And that is very stressful for these kind of students. So you can see, for example, that the kid has, for example, is always smelling things, or maybe they're overly sensitive to loud sounds, or maybe they are picky eaters. because they don't like certain flavors or certain textures, or sometimes
Mm-hmm.
they complain about the tags in their clothing, or they complain about the type of fabric because it's too rough to their skin, or sometimes they really hate to be tickled or hugged because they feel it's too much. Okay,
Mm-hmm.
so we need to take those things, those behaviors or those difficulties into considerations when we teach them. Okay,
Okay.
in order for us not to make them feel uncomfortable and develop disruptive behaviors.
Right. Or not make them feel weird because that's the way they perceive the reality around them.
Yes, yes, yes.
Okay. Okay. Let me just make a little parenthesis here and remind people that even though we don't have the box with the question mark, you can start asking questions. People have been quiet, either quietly listening or quietly somewhere else. But I know I'm sure they are with us. So please, you can start sending your questions. I know you might have some questions for Cynthia, and I'm sure that some of you have encountered this type of students in your classes, and sometimes you wonder about what to do, how to face specific situations, okay? So just dare ask your questions, and I know that Cynthia will be happy to try and help with some piece of advice for the situations you have with your students sometimes. Cynthia, so I have another question here.
Mhm.
Um, how can I meet my ASD students' educational needs in a time like this uh, during a quarantine?
Yes.
Because we are undergoing a special, this special conditions. If it's special for, uh, let's say, standard brains, it should be also of a particular challenge for students who have this, this condition as you were describing. Um, I mean, the social thing and the hypersensitive to certain aspects, etc., etc.
Yeah.
Okay.
Well, first of all, we need to remember that we need to provide structure, and that's kind of easy because even though we are, in a different setting and we are teaching classes through Zoom, we still have some kind of structure. We still have we have a schedule. So that is very important to keep that structure, because ASD students respond well to structure, and providing them specific routines and keeping them in place whenever possible will help these students to participate fully in our activities. Okay, that's one thing. Another thing is that we need to appeal to ASD students' visual nature. And that's kind of
Mm-hmm.
easier nowadays because of Zoom. Okay. If you don't know how to use Zoom and you just start talking and have a monologue with your students, well, I invite you to write an email to Joaquín and ask for help because Zoom, for example, has so many different things you can use. Not only just talk and talk and talk, or film yourself talking, but you can have a blackboard and you can make them write things and so many things and divide them into groups, but appeal to your students' visual nature. Okay, because
Okay.
and I'm not talking about visual intelligence or my learning style, because as we know, that's a neuromyth. Okay,
Right.
but we need to remember that because we are usually taught language through visual input, we need to use that to our advantage.
Mm-hmm.
Another thing is to remember that you need to adopt strategies to reduce your students' anxiety, and this applies to all your whole class. Okay, but it's important for you to provide your students of warnings if any change of the routine is going to happen. Okay, you need to communicate that in advance in order for them not to feel uncomfortable. Okay. And
Okay.
on the other hand, I invite you to take time to really talk to your students about how they are feeling in this situation. It is important for us to really, and maybe a UTP, una UTP might kill me right now, but I think it's important to stop focusing so much in the content or you know, just achieving some objectives, class objectives, and really focus in emotional strategies in order for you to help them communicate how they are feeling. Okay.
Right.
And work with that. Of course, you need to give your class and to teach them, but we need to understand that in these kind of situations, if you just start your class right away, their brains are somewhere else because they're maybe with their siblings or their parents that are working next to them, or maybe some of them don't have a good internet connection, and that's stressful for them. Plus everything else that is happening. Maybe their parent lost their job, or there's not enough food, or I don't know, so many things. So I need to really remember that I need to help my students reduce their anxiety. I can even take some breaks, and during those breaks, teach them how to breathe mindfully or practice mindfulness.
Right. As we were practicing last session with Lucrecia Prat, we were doing this. Breathe in, breathe out.
And breathe out.
Simple techniques like this. All right.
Yes.
All right. Listen, I have a couple of comments here. Someone was commenting about her own child. Okay. This is Melanie Spiraling. Thank you, Millie, for your generosity. She says, my daughter tends to do drawings when she tries to explain what's in her brain. Okay. She can't express most of what happens to her. She is still on mixed language disorder with some things related with ASD. Okay? And as you were explaining, I mean, you explained a very similar case, right? Yeah. Very similar case of someone else drawing.
And we have. Can I mention something?
Sure.
You need to encourage that. You need to encourage them to draw, and while they are drawing, ask them questions. So tell me, what is this supposed to mean?
Okay.
So you start to communicate with them through that drawing.
Okay.
Okay, so they feel comfortable because they are talking in their own language.
Yeah.
But at the same time, you are kind of developing in them emotional intelligence, because you are helping them to understand their own emotions and giving those emotions a name.
Great. And helping them develop this channel to express their emotions, right?
Of course. Of course.
I have Valita Sanhuesa asking, is it true that it can't be diagnosed before the age of 8?
No, that is not true.
Okay.
That is not true. ASD is hard to diagnose before 24 months, but you can see some signs of it even in 3 months olds.
Wow.
Okay.
There are already certain signals. Okay, interesting.
Yes. And if some signs are detected by 11 months of age or 24 months of age, then you can start treatment right away.
Okay, the sooner the better?
Yes, definitely. With everything
Okay.
related to disorders and developmental disorders, the sooner the better. Yeah.
Okay, okay. We have another question here. Marce Paola asks, suggestions to handle a crisis in an ASD child in a regular class?
Oh, well, it's as we said before, there are no formulas, and it depends on the case. Okay, it depends on the case. It depends on the age. It depends on the personality of the student. Okay, it depends on the type of issues he or she has. Because, for example, for some kids, just hugging might be a great strategy to use, but some of them hate to be hugged. So maybe you can have a corner in your classroom with pillows and some materials where they can just go every time they have a crisis. And maybe some teacher might say, well, but I am not allowed to have that space in my classroom. So it
Okay.
depends on the school. It depends on the teacher. But the most important thing is to go back to what we were talking about routine, because part of this is to psychoeducate not only the family but the student, and teach them and explain to them why they're feeling the way they are feeling. Of course, in a very simple way, and it depends on the age and so on, but and you need to adapt the language, but they need to understand in a way why they're feeling the way they're feeling. So when I know why I feel the way I feel, we can negotiate and say, okay, every time you feel that your blood is coming to your cheeks and you start feel like you're going to explode, you are going to give me a sign, okay? What do you think should be our sign, our secret sign? You decide. Well, I think if I say this, it means that I'm going to have a meltdown. Okay, so you as a teacher need to be aware of this, and you need to also negotiate it and talk about what we can do, what would make you feel better in a time of crisis. So it
Right.
depends on the student, it depends on the kid.
So we understand. Now, what you're saying basically is we should have previous agreements with the students.
Yes.
Getting to know him or her well, and have previous agreements on this is the procedure we're going to follow if
Yes.
something happens.
Yes,
Okay.
because that will make them feel secure.
Okay.
Because what's going to happen is predictable for me.
Okay,
So
and that helps a child
yes,
like this.
I know what's going to happen next. So if she takes me to that corner and makes me read a book, I'm not going to have a meltdown. I mean, I might. It depends on the case. It depends on even on the day. But I know she's not grounding me. I know she's taking me there because we agreed beforehand that when I felt like the way I feel right now, I was going to take a break. Okay. And that helps me as a teacher to, keep an eye on him or her, okay, and continue with my class as good as I can.
Okay, great. We have another question here. CANDUA, which in Chile goes for Diseño Universal de Aprendizaje, okay? CANDUA, I think in English it goes for Universal Learning Design, ULD. Can ULD be really a helping tool to manage / give structure when we have such diversity in a large classroom?
Yes, that's the idea of DUA. Well, that's supposed to be the main objective or the main goal for DUA. Yes, but it needs to be well implemented in order for it to really work. Okay,
Mm-hmm.
and that's a challenge because usually in Chile, in schools here in Chile, I hear teachers complaining all the time about DUA and saying what
Mm-hmm.
Miss Buglioni is asking. Does DUA actually exist? Like, okay, it sounds really
Right.
pretty and they tell us to do it and to implement it, but is it is it real? Is it for real? And well,
Right.
in other countries, they have implemented this kind of methodology and it has worked. But teachers need to be empowered with information and strategies in order for them
Mm-hmm.
to use them.
Right.
If I don't have those skills, it's going to be very nice in paper, but I mean, it won't work.
Right.
So
Probably you would agree with me that the most important element that DUA brought us in Chile or in other countries is the concept of multisensory ways to present information
yes,
and allowing and training students for multisensory presentation of their own results, or to show evidence that they are learning, right?
yes.
We have Romy asking, how much time can we be online with them? Speaking of this online learning, is there any suggestion, or it's okay being online more than 30 minutes, for example? She asks.
Well, that's a really good question. We need to understand that this is a very particular situation. I wouldn't recommend to expose small kids to screens on the first week.
Mm-hmm.
We know that there are some negative consequences, neurologically speaking, when we expose a small kid, and I'm talking from 0 to 2, 3 years old, to screens. Okay.
Okay.
And after that, after 3 years old till they are like 12 or 13, we still see some issues related to the way the brain works, especially with dopamine. When we have a screen that is interactive, that's when the most damage occurs in the brain.
Okay.
But I'm talking about normal situations. But nowadays we are forced in a way to be in front of the screen because the school is asking us to do so. And that's a challenge. That's a challenge, and scientists are now saying that we'll see negative consequences of this hyper exposure to screens, not only in small kids, not only in teens, but also in us as adults. It's very interesting because I read an article on the BBC last week that was talking about a new syndrome that they're calling the Zoom syndrome. And
The
there's
Zoom syndrome.
the Zoom
Okay.
syndrome. And they're talking about people developing headaches, lack of attention, lack of ability to retain information because of too many hours in front of the computer, trying to learn. So you need even if we need to use the computer to study nowadays, we need to remember that the attention span, especially in kids, it's really short. And we need to plan our class. Taking breaks and including breaks, long breaks. They are recommending long breaks between 10 and 15 minutes, and having modules of 30 minutes maximum.
Okay. Okay.
Because they're seeing that, I mean, it's not working otherwise.
Okay, so that would be the parameters.
Yes, but if we were in a normal situation with no quarantine and no COVID-19, I would say to restrict the time in front of the screens.
Okay, and that goes for every type of brain, right?
That goes for every type of brain, ASD brains, normal brains, or whatever.
Right. Yeah. Right. I have something interesting here. A comment by Aima Marino. I was recently diagnosed, she says, with ASD. I'm a 24 years old student of English pedagogy. I would like to know, why is it that nowadays there are more women being diagnosed in their 20s?
Well, because we know a little bit more about the problem. And even though there are more women now being diagnosed, we still see more men. This is a male predominant syndrome. So yeah, we now have more information, and we are still learning about this disease. Okay. The syndrome. Yes.
Right, the syndrome. So, okay, notice what someone else is commenting here. Millie Spiraling, how different is ASD in girls? Because most of the studies are based on boys. And nowadays we're having lots of girls who don't fit on ASD patterns, and they are, you know, waiting for a diagnosis. Is it that bad?
Yes, it is, because it's a pretty new syndrome. So we, as I said before, we are still learning a lot about this. We still don't know the cause of it. We have so many hypotheses or theories related to the causes, but we still don't know. Actually, in January came out this very interesting paper that was talking about, let me see, a link between ASD and myelin. And myelin is a kind of a how do you call it? A fiber, okay? Or yeah, we can say a fiber or a film that coats the brain circuits, and it gives them the ability to insulate themselves, and that helps them to quickly carry electrical signals between neurons, okay, from one area to the other. And, right. And they are now saying that there are 102 genes that if they are damaged or altered, they might produce too little or too much of this myelin coating. And that can result in a range of neurological problems, including ASD and multiple sclerosis or Alzheimer's disease.
Okay.
So myelin, this just came out in January. So they're just, we're just learning about this every day.
Okay. Okay. I have one comment by M.R. Patrick. This person says, as I said before, I worked in a school where most of my students were in the spectrum. I always work with them in particular projects. Then as part of another project, connecting their interests.
Yes.
Interesting how this teacher found a way to have them, with project-based learning, PBL probably, and connecting.
Yes, that's key. PBL, cooperative learning, flip learning, flip classroom. I'm sorry. All these new methodologies that we are now thinking about and using are going to really help us out working with special educational needs students. Yes.
Cynthia, time flew, and this time it's about an hour. It's about an hour. I want to thank you so much. We're about to, it's almost an hour now. And we want to thank you for taking the challenge of connecting. And we want to thank everybody connecting today. And I want to remind them that we will be connecting again next Thursday with another very, very interesting topic. Okay? Okay, we're coming live